So, we're going to cover in this recording these three most common career choices for exercise science majors. We're going to talk about physical therapy, athletic training, and occupational therapy. And we're going to take a look at some of the different practice levels and training, some of the different areas that you can specialize, the different types of salaries that these professions are acquiring, and the outlook for the future or the growth potential in each of those occupational areas, looking at the settings in which they work and the recipients or who are receiving their service. Also, and some of the day-to-day activities and tools. And of course, we won't be too specific in any of these areas because it is very different based on practice level and setting and all kinds of things, but we'll give some generalities for each of these three occupations. Starting with physical therapy. So, just a quick little interesting background. Physical therapy was actually born in the 1800s out of the sport of gymnastics. And I love that this picture kind of represents, and if I showed you any gymnast, doing the rings or the horseshoes or what's it called? Is it called the horseshoe? I forget what it's called, but if you're a gymnast, I apologize. But all of the different events in gymnastics take quite a bit of joint flexibility, and probably those joints sustain a good amount of impact with all of the different techniques. So physical therapy was born out of the rehabilitation of gymnasts in the 1800s. It quickly evolved with, especially with, wartime or reconstruction aids with the war. And then in the 1900s, there were, official formal associations formed. And it wasn't until like the 70s where we had the specializations and the licensing laws. So the field has come a long way, but it's by no stretch new. It's been a solid licensed, profession for over 50 years, but interestingly born out of gymnastics. The different practice levels and training for physical therapy are kind of showing. You can go anywhere from a physical therapy aide, which you could get a job doing that now with CPR certification, all the way up to a doctorate degree. So in the middle, you have the PTA position, which is the 2-year associate's degree plus the exam. Now, all of you are in a bachelor's program, so you're probably not interested in this pathway, but in the case you don't get into the doctoral level programs, it is something of interest to think about the PTA because there are bridge programs where you can bridge your assistant license to a doctoral license. And again, it just kind of shows a mark of maturity if you ever wanted to reapply to the DPT. So there is a 30-unit PTA program at Mesa. And this is just kind of FYI to give you something that you couldn't find by just reading online. So the physical therapy program, or the DPT, I know most of you know, but we have a program here at State. It's a 3-year professional doctorate degree that when you're finished, you take a licensing exam so that you can use comma after your name, DPT. And of course, standing for doctorate in physical therapy. Now, the salary and outlook for these fields, it's really healthy for both areas. Growth is a little bit faster in the PTA or the assistant role. And we talked about this in the healthcare trends lecture where we were saying those support roles are growing. We also know that physical therapists make substantially more than physical therapy assistants and of course aides. Aides make anywhere from 25 to 35. So it's not quite as lucrative, doesn't have that degree required. So the physical therapists make about $90,000 per year, way more in San Diego, but I couldn't find quotes that I thought were good because all the physical therapists I talked to make more than even the higher percentiles. So I think that here in San Diego, they're over $100,000, but the growth, which is kind of what's important, there's a lot of job opportunities. And so especially for students in your position or pre-professionals, I should say, in your position, the growth and the outlook in the next 10 years being rich is good for you entering into that job market. Just to take a peek at some of the different requirements to go to a doctorate in physical therapy program. These are the requirements for schools in California. Of course, you could look at the APTA website and find national programs, but I just wanted to give you a little glimpse of the schools here in California just to kind of show you what they require. You need to take the GRE, which is just a test to get into grad school. You have to have a GPA minimum, a number of observation hours, and then you have to have letters of reference. So people that speak to your qualifications. Usually they require at least one academic or professor and at least one from a practicing physical therapist. One, ideally, that you worked with in your observation hours. Now, I also bolded up here a couple things just to highlight, different features that you might want to look for when you're applying for schools. If you have a ton of clinical hours, look how many Northridge is requiring compared to other schools. They really value that extra experience. On the other hand, Loma Linda has a much higher, and zero point 0.2 is a pretty significantly higher GPA minimum to apply. You have to have a 3.2 minimum, but they don't make you take that GRE test. So interestingly, they care more about that longevity in academic performance than the standard test. One other one I thought was kind of interesting on here was the Chapman having no letters of reference and very few observation hours. So that might be something interesting if your GPA isn't, or I'm sorry, if you weren't able to acquire letters because of the pandemic, then it just, it gives you options for places that you might consider applying that you might have otherwise not because of just whatever you have as for your applicant record and transcript. Let's see. Some of the specializations that you can earn in physical therapy include all of these listed. There are actually, I think there's 8 listed here. There's 8 specializations that are through the American Board of Physical Therapy Specialists. So the actual ones that are through the APTA. So these specializations are the ones that are most common that you see, but you guys, there are hundreds and hundreds and hundreds of different types of letters behind the names of physical therapists. You could be a wound specialist, a hand specialist, a hip specialist, a pelvic floor specialist. I mean, there are just a ginormous amount of specializations, but these are the official categories by the Physical Therapy Association board. So these are interesting areas because the orthopedic setting is the biggest. There are the most number of orthopedic specialists, and there are the fewest number. So the smallest market is the cardiopulmonary clinical specialists. So the biggest and smallest specializations. The sport specialization is, I think, the ones that I hear most common that our students are interested in. And that, pairs well with our athletic training and all of the things that we have going on with exercise physiology within our school and within our academic programs. But the sports clinical specialist also pays the most. So that's kind of exciting for people that want to go into that route. Now, something that you should think about is that not necessarily all physical therapists are fit to do the sideline athletic training gig. And so some of us think that because we've been in physical therapy that we want to go into sports physical therapy, but sideline and acute emergency care is different than, the long-term physical therapy settings that a lot of us associate with sports physical therapy. So just kind of pay attention to some of the research that's been done. And this is just one example of an article. It's not required, but if you were interested in learning about the more human sides of things that I don't teach too much about, are physical therapists qualified to provide sideline coverage? It's a good conversation. Now, one of the ways that you can specialize in sports, or the only way that you can specialize in sport to get the SCS after your name, DPT, is to do a residency. That requires 2,000 hours and a board exam, okay? So the board exam and the 2,000-hour residency, you can do those at a number of sports, facilities, like the Olympic Training Center had a residency program, different hospitals, different athletic teams, but the residency will give you the hours that you need, and then you take the test to become certified. Now, the exam breakdown, I would never, expect you to commit this to memory. I just kind of wanted to give you a small glimpse of what was on the exam. It's basically looking at reevaluating and examining athletes, clearing them back to play, acute injury management. So what happens during gameplay, etc. So that's kind of the things that you'd be tested on. And it looks much like what you would see in an athletic training certification board exam. So I forgot I put this up here. Gosh, I think I need a drink of water. My throat's dry. It is kind of dry today. I'm not surprised. But anywho, other areas that you may not consider, and they're probably like, what is she talking about, are equine physical therapy, canine physical therapy, or back to the human side of things. You could also specialize in dance, entertainment, or a bunch of different little sectors that you may not even think of. But animal and canine physical therapy, I thought was of particular interesting to highlight because it's just an untapped market. I'm a nutrition person, and have a background in nutrition. I taught nutrition before moving over to the more in the exercise science realm, but I saw the boom in dog food in the late 90s and really the last 20 years, but this wasn't the case. And so physical therapy is going to be the same. People care about their dogs. It started with their diet. Now we know that we have canine chiropractors. I mean, you name it, but there's not very many facilities, and you can actually specialize. It's of course branches over into veterinary medicine, but you can specialize in canine physical therapy. So just giving you some ideas to think about where you can go with this if you're not like dead set on doing the sport thing. Some of the different settings that physical therapists work in, there's honestly, you guys, it's the sky's the limit. I mean, people do a million things. You've got micropreneurs doing physical therapy things out of their home, doing programming from home. I mean, there's a million things people do, but generally, if you look it up, these settings that are listed for physical therapy practitioners are listed here. Even though the most physical therapists aren't employed in schools or they're not super concentrated in schools, schools are actually the highest paying employer of physical therapists. I thought that was kind of an interesting fact because I would have expected it to be more of a skilled nursing or home health, something private. But schools pay physical therapists excellently. It's just not a very, concentrated position within schools. The recipients of physical therapy, this is kind of an important distinction. I guess I won't make it here. I think I'll make it when we talk about athletic training. But the recipients of physical therapy are typically not in an emergency situation. They're in more of a longitudinal treatment and care situation, right? So physical therapists, while they do work in hospitals in a post-surgical area or something to that effect, or trauma, typically they work in clinics or places where people go for follow-up care. So the recipients are not in a sense of urgency. They're typically not immersed in the care, like living there. Sometimes they are, if it's again in an inpatient facility. But the bottom line is that they're movement impaired. They're in pain and they have a wide range of age and physical abilities. So you may have a super stud athlete who is 24 years old and you may have a 90-year-old who can't even sit and stand. So again, very wide range. And you may have people who have disabilities that are doing rehabilitation. So you have a wide breadth of people that you're working with or the recipients of your service. But again, they're not really in an acute emergency setting, typically having physical therapy. The day-to-day, a job of a physical therapist is, and this again, you guys, this isn't something I can speak to with specifics. This isn't for accuracy. This is to generalize the day-to-day of a practicing physical therapist. And of course, you're going to go out and see this and ask questions and do observation and listen to those videos and get this stuff on your own. This is just what I've collected and generalized/summarized for you. So PT see about 8 to 10 patients per day. Typically, they spend about an hour with each patient and they'll do some sort of assessment or patient history where they'll gauge what happened to the patient, what the patient is feeling in terms of their symptoms, and they might do some diagnostics, some assessments. So they might test range of motion, strength, flexibility, whatever it is, so that they can get an idea of what's going on. Now, this will vary extensively based on the type of PT clinic that we're looking at. If we're talking about a, neurology clinic where we're looking at neurorehabilitation, you're going to see more sophisticated and high-tech diagnostic and treatment tools. You might see, brain scans and electromagno things in electrophysiology settings. But in ortho settings, you might see something in treatment for modalities as simple as ice, right? So treatment modalities and diagnostics vary greatly depending on the setting. But essentially, the day-to-day would be that they would take a history, they would do some assessments or some diagnostic tests, and then they would do some treatment modality. And again, ranging depending on the setting, but that's typically kind of like the duties and the way that the flow of care goes for PTs in a day. Of course, they spend a good amount of time doing records and billing, like I think any profession, but ask someone how they feel about this and if it takes a ton of time and if they have figured out smart systems to make this a less cumbersome part of the fun practice of physical therapy. Work life. So a couple interesting things, and again, you guys, there's tons to learn about. I just picked out what was interesting to me in my gathering and acquiring of knowledge. It's a physically demanding job. So I've been to PT, my kids have been to PT, I've seen it because I've just paid close attention to prepare lectures like this, and boy, it is not a job for the lazy or the unfit. You stand all day, you help others lift extremities, and you are busting butt to teach others. It's just like being an exercise a group exercise instructor only all day long with low intensity exercise. So it's hard work. Also, in that is a very good amount of working in close proximity to others. And obviously, you guys have probably seen physical therapy, but make sure you're well aware of this part, because this would be a part, I think, for me over time would probably be something about the job I don't love. Not saying I'm not a hugger, but I just wouldn't all day probably want to be up on other people physically. Now, some people love the manual and hands-on part of that. So that's literally attracts people to it. It's just, like I said, it's something that you should see for yourself. Last thing on work life, and I think this again is a very general statement, but and it'll come with my own kind of deductions, but everything I hear and read is that physical therapists have a high degree of job satisfaction. I mean, this has been published in articles. There's been things in Forbes and Fortune 500 magazines about people love being physical therapists. And I think, and then here's where my injections come in, or my injections, interjections. I don't even know what the word is, but my opinion, I think, is that physical therapists have an incredibly high sense of task completion, right? So they go to work, they work with a patient for not forever, and that'll kind of distinguish them from occupational therapists, which we'll talk about later, but they don't work with someone forever. They only work with someone long enough to actually see outcomes. So if you work in a setting where the patient just comes in and leaves, maybe not as much, but I think the physical therapists that work in outpatient settings and in more clinic settings, they really have a good sense of seeing patients improve, and they feel good about that task completion. Some professionals need that. I need that. I need students to get A's to feel like, okay, I did my job. Some people don't need that. They can just go along with the small things that take place and the small improvements that their jobs are making. But physical therapists have high degree of job satisfaction, to which I personally think is attributed to their high sense of task completion in that job. They also don't deal with a lot of the nuances of legal issues that regular physicians deal with in terms of when to admit patients, when to, all the different nuances of legalities and billing and insurance. They're not quite as tied down with it. So just my interpretation, but the point is that they love doing it. It's just a fulfilling long-term job. Switching gears and talking a little less long-winded, because this is a smaller pocket of you guys, but I know you're out there. Athletic training, another occupation in healthcare that is in the realm of exercise sciences. Athletic training, folks require a certificate. So to be an ATC or a certified athletic trainer, you have to do a 2-year master's program. And this is brand new. Of course, you guys know that right now it's just bachelor's level, but we don't have a bachelor's level program available anymore to students matriculating through SDSU. So you have to get the master's level. So master's will be required along with the test, which is called the Board of Certification exam, to earn that ATC certification. Now, just like I started a little bit of a history with athletic training, it was actually born out of the sport of track and field. So it was in the early 1900s, a little after physical therapy. There were lots of injuries taking place during track and field events, and they started having medical specialists on the field, which morphed eventually into athletic trainers. And then again, kind of like physical therapy, it was in the 70s and 80s when really the specializations and subspecializations and certification programs took off. And academic programs like the ones that we have here at San Diego State. The salary and outlook for AT, it doesn't look great if you look in the national median. It's 50 grand a year, 16% growth, which is higher than average, and I'll get to why in a little while when we talk about settings. But it looks low, but just I know for a fact here in San Diego, it's at least $10,000 higher right off the bat. And at the higher percentiles, which are, there's a lot of sporting, a lot of colleges, a lot going on in San Diego for athletic training, but most people I talk to are closer to this 90th percentile, it's over 80. So big range in salary opportunities for athletic trainers, but we'll talk in settings about how versatile that certification can be. So the major settings for athletic trainers include spectator sport events. So just like how it sounds. If there are lights, if there are people parking, if there's anybody organizing a ticket at the front, even if there's not, it could be for a high school. And then of course, none of that exists in terms of lights and parking administration, but spectator sport events. So fields, courts, pools, gyms, arenas, etc. That setting particularly pays really well. Sport spectator events have the highest paid athletic trainers. Schools are also a common setting for athletic trainers. In fact, schools are the number one employer of athletic trainers overall. Now, higher education athletic trainers like colleges and universities, they get paid more than primary, or really there aren't a whole lot of athletic trainers in primary education or elementary, but they are occasionally there, but secondary in high schools. Almost all high schools that have sports organizations have a high athletic trainer. So they're paid more at the higher education level than the high school level, but interestingly, they're paid more at the community college level nationally than they are at the university or the not community college level, the four-year institution level. So I thought that was really interesting. And you do occasionally hear athletic trainers excited about getting their job at the community college. And it wasn't until digging deeper I figured out they pay better at the community college for athletic training. We also see, and here's where it kind of crosses over in terms of, even though the pay doesn't look amazing over in the other side of things, I think there is a lot of higher paid positions where a lot of athletic trainers are employed in clinics. So orthopedic offices or anyone doing follow-up care for, where bracing is needed, where taping is needed, where follow-up care for orthopedic injuries are their specialty, that's what AT do. Recipients are all sorts of ages of people, but typically healthy and physically active. So you're dealing with sports injuries as athletic trainers. Otherwise, you would just be a regular doctor, right? The reason you're an athletic trainer is because you're dealing with movement injuries, exercise injuries. The job activities of an athletic trainer are really varied depending on the setting. Like I mentioned, of course, an athletic trainer in a clinic setting is going to just see patients all day, and he's going to work for the physician to band-aid and brace the patients that come in for follow-up care from surgery or whatever. And then on the field, you might have one that's like has their little kit and they're like ready for sideline injury diagnostic and treatment. So wide range of differences in the actual activities, but the overall general duties and activities that they perform are injury prevention. Things like when you tape an athlete's ankle before practice, which you probably all remember if you ever played high school sports, but that's injury prevention. It might also be rehabilitation treatment to make sure that ankle is healing even on your way home. They also do emergency medical care, again, right there on sideline. One of the biggest things to bring up with athletic training is the ethical issues that take place. And we haven't really talked a lot about ethics, but ethics is a big part of working in healthcare. Not only are you dealing with human beings, but you're dealing with a business and money. And really, when it comes to athletics, a number of ethical things like gambling and doping and all supplement use. I mean, there's a lot of ethical issues about athletic training. But one of the most pressing ones is clearing athletes back to play. Telling an athlete that they can step back on the field, diagnosing them as not having a concussion and being safe, and evaluating their safety to go take their body and put back on that field, which of course people are pressuring you to do, right? So there are a lot of nuances with being an athletic trainer. They're exciting and they're powerful positions to be in, but you have to be very ethically and morally grounded to take on that sense for a career. Now, some of the differences between AT and PT, I think are best said, which is why I brought it up here, with the job activities. So they're similar in the rehabilitation treatment, but what's the big difference is the immediate emergency care, okay? So athletic trainers and PTs both prevent injuries. My son is seeing a physical therapist. We're paying mostly out of pocket for someone to strengthen his elbow so he doesn't hurt it again, right? He's not currently hurt. He's hoping to not hurt it again. So they both do injury prevention. They both do evaluation and assessment in a clinical way, obviously. But what's different about them is that emergency medical treatment. So athletic trainers are essentially like doctors and nurses, or athletic injuries only, not just any injuries. Physical therapists do any injuries, of course, or even diseases like arthritis and stroke, etc. Okay. Here we go. So let's talk a little bit more about some of the alternates and ancillaries that AT folks do. So athletic training, as you saw, can pay as little as $50,000 on average median. So oftentimes people take on more things. They might take psychology courses so that they're prepared to apply for positions that are in the realm of working with coaches and working with athletes who have been injured and adjusting psychosocially to their injury. We also see athletic training students oftentimes work on their teaching credential, and it's a very few amount of additional prerequisite courses that you would take on top of a kines degree to be able to get a credential to teach PE. And that way it makes sense. If you're at a high school, you teach PE, you have that salary, and then you have your additive athletic training salary on top. A lot of those students also move into the PT realm after practicing for a few years. So they go back and take those sciences that they didn't get and they do DPT. A very smart move for getting hours and clinical experience also in emergency medical treatment is to do the EMT certification. This actually is also true for anything. It looks good on a resume, but especially if you're going into like PA school or something that needs a ton of hours, you can get them through these EMT certification programs. Other routes are medical exercise or kinesiotherapy. These are actual certifications through, like American College of Sports Medicine, but there's a very fine line between, athletic training and medical exercise. So I like that bridge. And then we'll talk about this one next time with the health and fitness unit. But a lot of you guys also do your certification and sometimes even simultaneously, but athletic training and strength and conditioning. And that way you've got both sides and both modalities for your work. Occupational therapy. So occupational therapy is another really exciting field that I think people find rewarding and that fits perfectly into healthcare using movement science. Practicing levels and training, there's occupational therapy assistants and occupational therapy registered or OTR. The difference between them, it's much like physical therapy in that there's a 2-year for the assistance program plus the exam. And then to get the actual occupational therapy license, register, you have to do the master's. So it's not a doctorate, it's a master's, but there is a little bit of a difference because of course what's in between is the bachelor's degree, right? So you got to get the bachelor's and the master's to do the OTR route. Now the salary and outlook for OT is really, really good. Wow. I mean, I don't have to say much, but OTAs, the assistants for occupational therapy, are making, this is the associate's degree. You guys are already, past that level in terms of being in a bachelor's program. The OTA positions are making a lot, 60 grand a year with 32% growth in the next 10 years, which is really, really good, you guys. It's much faster than the national average, and it equates to like about 17 to 20,000 jobs in the next 10 years. OTR, huge amount of growth too. You can see I listed 143,000 jobs, slightly lower percentage just because there are less OTAs in general. But look at the salary on those guys, $86,000 per year, and with much higher range, and we'll talk about this in certain settings. And the reason that we're seeing so much growth in occupational therapy, you guys, and this kind of bleeds into the job activities, is because people are aging, right? So we also have more diagnostic tools and better, and I should back up. Healthcare reform. It goes back to what we talked about last time. People have healthcare now. So when you suspect your child might have autism, you take them to a specialist. When you suspect your folks might be starting to have Alzheimer's, you take them to a specialist. So because people are getting older and we have more healthcare and resources to be able to take them to specialists, there are more OT positions available. There's more autism, more aging population, huge growth in the need for occupational therapy, which perfectly transitions into what they do. They take care of people's needs almost just like physical therapy in that they habituate and sometimes even rehabilitate, but usually they're more in the habituative realm, but it's with daily living skills. And so occupational therapy was born in a setting of mental institutions where people weren't even able to do functional skills like gardening, filling salt and pepper shakers, using utensils, activities of daily living, which we learned about in part 1 when we were looking at what are the different types of physical activity. One of those types is just activities of daily living. This is what occupational therapists specialize in. Whereas physical therapists specialize only in mechanistic, rehabilitation movement to fix an injury. These guys don't fix injuries. They take cognitive, mental disabilities and physical disabilities, and they treat people how to function and live independently with those disabilities. So hopefully that kind of makes a sense to you. I think the biggest difference when I'm talking to students about OT or PT, because you'll work with a lot of same people, you might use some of the same modalities, some of the same job tools, but what will be a very big difference between them is the longitudinal nature of your care. You might work with an OT patient for 10 years or more, their whole childhood, where you might see someone in PT for 2 months, once a week. So the nature of the care is different. OTs sometimes go to people's homes and they literally go there 5 days a week. They're part of the family. I'll get personal. My best friend has a little boy with Down syndrome. The OT is there every day, has been since he was a baby. And of course, not everyone has those type of resources, which is why, and this will transition to the next part, we also have OTs employed in schools for kids that go to school and still need that one-on-one occupational therapy care, which again, functional daily living skills. Why would they be needed at school? Because someone has to teach kids that need that type of special care to use a pencil. It is not as easy. Those kids don't just look around and figure it out. They need someone that's trained to teach them how to use the pencil and hold the pencil differently than maybe other kids in kindergarten or first grade. So hopefully you have a difference between OT and PT. There's the longitudinal nature of it, and there's the daily living aspects of it. Just kind of show you that there are very similar requirements between occupational therapy and PT programs. The only glaring difference is the prerequisite requirements. So instead of having like a million prereqs, the prereqs are kind of the same ones included in your degree. It's like anatomy, physio, stats, whereas, physical therapy has the extra chem, it has the micro, the physics, it has a lot more in terms of prerequisites, but otherwise pretty similar in terms of requirements for those programs. In fact, if you want to go to an occupational therapy program and you're working on a kines degree, you only need 3 to 6 extra units, a medical term class and a developmental psych class. The settings that occupational therapists work in are listed here. The recipients of their care are a wide range of ages, like I mentioned before, lots of old folks who have dementia, and a wide range of physical and mental disabilities. It could have been an acquired disability, like I got in an accident and now I'm I was going to say paraplegic and quadriplegic in one word. I am a quadriplegic. I was in an accident. Or it could be an innate disability. I was born, with cerebral palsy. So there's all sorts of different disabilities, whether innate or acquired. The highest number of occupational therapists are employed in outpatient clinics and hospitals. The highest paid, interesting, are employed in schools and skilled nursing facilities. So they pay measurably more. And in fact, I've seen school positions where they're advertised for over $100,000 a year for school occupational therapy. Also, skilled nursing facilities, they have the most dense concentration of occupational therapists in terms of the total, job pool. So what that means is like skilled nursing facilities, the OTs are an integral part of skilled nursing, whereas in a hospital, they're a much smaller proportion of the, healthcare professionals that are on staff. Schools, home health environments, and industrial and workplace environments where they would go in and tell someone, oh, whoa, ergonomically, let's look at things we could improve with your occupational positioning, etc. But those 3 settings on the last 3, they travel. Okay, so that's an important thing to know. I've known tons of OTs. They love this part. They're like all over the place. They never sit in one spot. You have a district occupational therapist that goes to several schools, or a home health practitioner would go to several homes or several corporate offices, etc. So lots of travel when it comes to those last 3 settings. And the rest, again, are kind of stationary and in the biggest way employed in those first 3. So that is all I have for occupations in exercise science for this lesson. Thanks for listening.